Okay, so we're going to continue on with our axial portion of our skeleton. We're going to move on to our vertebral column and all our vertebra. A couple interesting notes. I'm sorry I'm going to talk for a little bit before we actually get into some of the anatomy here. We're going to work through four major curvatures of our vertebral column. Two primary, two secondary. And I know that might be a little confusing right now, especially haven't covered this in lecture yet, but I'm going to outline what those are in a second. You need to know a couple things. One, what are and which are the primary and secondary curvatures. Two, how many vertebra in each of those curvatures. This is going to be particularly important when we start doing some of our spinal nerves and counting spinal nerves. So let's run through it. Our four curvatures are these. We have our first curvature, which is the cervical curvature. It has 7 vertebrae. Our second curvature is our thoracic curvature. It has 12 vertebrae. Our third curvature is going to be our lumbar curvature. It has 5 vertebrae. Our fourth and final curvature is the sacral curvature, and it is a fusion of 3 to 5 vertebrae. When we look at the sacrum, you'll see the remnants of those, the ridges on the body in that bone. So let's talk about primary and secondary and how you're going to remember these fancy numbers. Well, again, remember there are 7, 12, and 5 in our first 3 curvatures. Here's how I tell my students to remember it. We have breakfast at 7, lunch at 12, dinner at 5. So our 7 will be our first cervical. Our 12, our lunch, would be our thoracic. Our dinner at 5 would be our lumbar. Now, primary and secondary. Our primary curvatures are one that are established at birth. So for example, the thoracic curvature, it supports our lungs and our heart, our respiratory system, and our cardiovascular system. This is going to be super important once you're born, so these are going to be primary curvatures. Your sacral curvature, which is going to support all your urogenital organs, is another curvature that is established once you're born. It is a primary curvature. Lumbar and cervical are secondary curvatures. They take a little time to develop, and this makes sense if you think about a baby. What can a baby not do as soon as it's born? A baby cannot hold its head up nor walk. It takes about 3 months or so for that curvature, that cervical curvature, to establish so that baby can hold its head up, and about 10 months to a year and a half, sometimes even longer depending on the child, for that lumbar curvature to fully establish in order to allow that baby to stand upright and walk. Okay, so let's get into some of the anatomy on these structures and how to differentiate them, because on an exam, you're not going to have it articulated like this. You're going to have them separate, and your job is going to be to identify some of these landmarks and identify what region these bones belong to. Well, it's pretty straightforward. The nice thing about the vertebra is they have pretty much all similar structures. For example, 99% of them, and we'll talk about that 1% in a little bit, have a big body or have a body. Okay? They're going to have superior and inferior, so superior and inferior articulating processes with facets. And they're all going to have a spinous process. The spinous process is going to look a little different from bone to bone, but they're all going to have a spinous process. And they're all going to have a pedicle. This is this region of bone. If I were to draw a circle that kind of connects the body to these structures here, that is going to be our pedicle. Okay, and then they have a lamina or lamina, this region right here. If I were to draw a circle through that vertebral foramen or through this hole around this plate, lamina means plate of bone, there's our lamina. So they all have pretty much the same structure. And again, one more I'm going to show on. This is a really cool one, is this vertebral notch. And we'll talk about why this is so important in a little bit, but it really doesn't do us any justice looking at it separately. We're going to look at it again when it's all together. So we have the basics down. We know the basic structures that all these vertebrae have. Let's look at some important ones and how to differentiate them. So we're going to start right at the top, right here. C1, super important vertebra. It is that 1%, no body. Notice there's no body here, no body. It lacks a body. Okay, it's going to articulate with those occipital condyles in the skull, and it's going to give you that rocking yes motion. That when you want to shake your head, yes, I am studying for my bone exam, this is where you're going to be rocking on those occipital condyles. Big hole, vertebral foramen, spinal cord is going to go through here. Now, transverse processes, these are these wings that are hanging off to the side. Now I want you to notice something. As we move through the rest of these and the skeletal system and the appendicular portion and the arm bone and the leg bone and the feet bones and the vertebral bones, all these bones are going to have at least 2 key characteristics that's going to help you identify what region they belong to. And here's one of them right here, that transverse foramen. Only cervical vertebra have holes in those transverse processes. So you pick up a vertebra, it may not be C1 or the atlas, and you say, oh my God, there's holes in those transverse foramen. It is cervical. Okay, so just a quick little history note why this is called atlas. If you think back to Greek mythology, the Greek Titan who was punished by Zeus to carry the world on his shoulders, his name was Atlas. This bone does support, well, with muscles that are going to help stabilize the head, supports the head right here on those two little facets. Okay, and that's where that condyles, occipital condyles, are going to rock in. C2 is going to be another important bone, and you look right away, you're like, wow, that looks completely different than any of the ones we've seen so far. This is called the axis. When you take the atlas and you articulate them, put them together, the axis allows us to pivot our head and rotate it left and right. So we get this left and right motion, as in saying no. So our atlas gives us rocking yes, our axis gives us our no motion. Well, the protrusion or the process that allows us to shake our head no, that binds it in, is called the Odontoid Process or the DENS. I'm perfectly fine with either one. We have our superior articulating processes with our facets and our inferior articulating processes with our facets as well. You have a nice body. Remember, the atlas was the only one who does not have a body. There's our body for the axis. Now, our second key factor. Look at the spinous process. I'm going to turn it sideways so you can kind of see. It's split in two, and I'm going to show you another one that shows this a little better. It's called a bifid spine or a bifurcated spinous process, split like a snake's tongue. Again, this is only seen in cervical vertebra. There's number 1, transverse foramen on the transverse process. So, look at this beauty right here. If I were to say to you, what region does this belong to? Right off the rip, you should be thinking bifid, bifurcated spine, transverse foramen, okay? You should be thinking cervical. Okay, there's our body, transverse processes, pedicles, lamina, okay? Let's go to our third vertebra. And I'm holding this like this on purpose. I like to tell my students to try to make as much fun as they can out of this work. What animal does that look like? I'll give you a second. A giraffe. If you said giraffe, you guessed it right. It is a giraffe. When you look at this vertebra and you say, oh, look, there's our nose, there's our ears and our antlers, and you say, oh my God, it looks like a giraffe. That long, downward pointing spinous process is indicative of a thoracic vertebra. We have long, wide spanning transverse processes. These are going to reach out and hug a rib. Notice there was 12 thoracic vertebra for each of our 12 ribs that we're going to look for in a little bit. Vertebral foramen, body, pedicle, lamina. Superior articulating processes with the flattened facets, and our inferior on the bottom, inferior articulating processes with those articulating facets as well. And we have a couple demi-facets on the side, on the body, that's going to where our rib is going to articulate here. Our last vertebra that we're going to look at is going to be this guy right here. And again, I'll give you a second. What animal does this look like? And if you said moose, you are right. This is our moose. This is our lumbar vertebra. Well, let's look at our two key factors that help us identify this as being lumbar. One, massive body. These are big weight-bearing vertebra, so we need to have large bodies to support all of our body weight. Look at the spinous process. I'm going to hold it from the side so you can see it. Flattened, blunt, hatchet shaped like an axe. It is a blunt hatchet shaped spinous process. This is going to be key for supporting big muscles to support our weight and our back for our lumbar vertebra. Transverse process, superior inferior articulating processes with our adjoining facets. So I want to show you one thing, and I promised you I would show it to you together. If you think back to our vertebral arch right here, this is key because when you put this together, now again, I'm not really doing the spinal column justice because lying in here should be a fibrocartilaginous pad that's going to give this structure support. So I'm going to kind of just put it together just for ease of me holding it. But you notice that our vertebral arch forms a hole. Okay, our vertebral arch forms a hole. That hole is called an intervertebral foramen. And every time students look at our bone list and they say, I can't find the intervertebral foramen, inter means between vertebral vertebra. Well, there it is. This is where all our spinal nerves are going to come out. You have to have these articulating, these jointing together so that you can see that intervertebral foramen. Okay, so that pretty much is going to conclude our vertebral column. Our next tutorial is going to look at the sacrum and the coccyx.